Can non-invasive colon screening tests be trusted? Have you ever wondered if non-invasive colon screening tests can be trusted? These tests, like the fecal immunochemical test and the multi-target stool DNA test, are becoming popular for colorectal cancer screening. They offer a way to check for cancer without needing a colonoscopy, which many people find daunting. But how reliable are they? Let's break it down. First, let's talk about effectiveness. The multi-target stool DNA test, often known as Cologuard, has a high sensitivity for detecting colorectal cancer, around 92 to 95%. This means it's quite good at finding cancer when it's there. In comparison, the fecal immunochemical test has a sensitivity of about 70%. While both tests are effective, they are not as sensitive as a colonoscopy, which is considered the gold standard for detecting both cancer and precancerous polyps. Next, we should consider specificity, which is how well a test identifies people who do not have the disease. The fecal immunochemical test has a higher specificity, around 95 to 96%, meaning it produces fewer false positives. The multi-target stool DNA test has a slightly lower specificity, around 87 to 90%, but it makes up for this with its higher sensitivity. There are also newer blood-based tests that show promise. For example, the Shield test has a sensitivity of about 83% for cancer detection and a specificity of around 90%. However, these blood tests are not as effective at detecting precancerous lesions compared to stool tests or colonoscopy. One of the main advantages of non-invasive tests is that they are safe, convenient, and generally less expensive than colonoscopy. They do not require bowel preparation or sedation, which can be a barrier for many people. Increasing participation in screening is crucial for colorectal cancer prevention, and non-invasive tests can help with that. If a test result is positive, a follow-up colonoscopy is recommended to confirm the diagnosis and possibly remove any polyps. However, it's important to note that non-invasive tests are screening tools, not diagnostic tools. This means that if you get a positive result, you will need to undergo a colonoscopy to confirm the findings. Additionally, these tests have lower sensitivity for detecting precancerous polyps compared to colonoscopy, which means some early lesions could be missed. The frequency of testing also varies. The fecal immunochemical test is typically recommended annually, while the multi-target stool DNA test is suggested every 3 years. Blood tests are still being evaluated for the best intervals. Costs can vary, with the fecal immunochemical test being less expensive, while the multi-target stool DNA test may be pricier but could reduce unnecessary colonoscopies by better assessing risk. Major health authorities, including the United States Preventive Services Task Force and the American Cancer Society, endorse non-invasive tests like the fecal immunochemical test and the multi-target stool DNA test as acceptable screening options for average-risk adults starting at age 45. However, colonoscopy remains the preferred method for individuals at higher risk or those with positive non-invasive test results. In conclusion, non-invasive colon screening tests can be trusted as effective tools for colorectal cancer screening when used appropriately. They provide a valuable alternative to colonoscopy, especially for increasing screening rates and early cancer detection in average-risk populations. However, they are not replacements for colonoscopy in diagnostic evaluation or high-risk cases. Understanding their accuracy, benefits, and limitations is key to maintaining optimal colon health and preventing colorectal cancer. Always consult with your healthcare provider to determine the best screening strategy for you.